Polyheme and the Ethics of Informed Consent by Mora and Tatum.
The Polyheme study was a multi-center clinical trial conducted in the early 2000s across trauma centers in the United States. It investigated the use of polyheme, which is an experimental blood substitute, in patients experiencing severe blood loss due to traumatic injuries. Many of the patients enrolled in the study were unconscious, and thus they were unable to provide informed consent. As a result, researchers used an emergency exception from informed consent, or EFIC, to include participants.
The purpose of the study was to determine whether polyheme could improve survival outcomes when traditional blood transfusions were not immediately available. Ethical concerns arose because patients were enrolled without their knowledge or permission, and many were not adequately informed after receiving the treatment. Additionally, some patients received polyheme instead of standard blood transfusions, even when blood may have been available, raising further concerns about patient safety and research practices. These issues led to significant criticism and highlighted gaps in the ethical conduct of emergency research.
The main ethical issue in this study was informed consent. Informed consent is a key ethical principle in research and healthcare, meaning patients must understand and agree to participate. In this study, many patients were unconscious, so consent could not be obtained. Researchers used an emergency exception, but this still raised concerns about patient rights and autonomy.
EFIC is a special exception that allows researchers to enroll patients in studies without consent during life-threatening emergencies. It's used when patients are unconscious and there is no time to contact family. While it is legally approved and regulated, it remains ethically controversial because it limits patients' autonomy.
The most violated principle was autonomy, since patients could not make their own decisions. Autonomy, so other ethical principles that were violated were beneficence, which is because the study aimed to help patients, but it was unclear whether or not polyheme truly provided more benefit than standard blood would.
Non-maleficence, which is do no harm. The patients were exposed to potential risks of an experimental product. They weren't exactly sure if polyheme was a good substitute for blood. And some patients may have been harmed by receiving the polyheme instead of proven treatment. Justice was also violated because the vulnerable population, which is unconscious trauma patients, were selected, and the patients had no ability to opt out because they were unconscious.
So the impact on cultural values in healthcare research, the study it reinforced the importance of protecting patient rights and informed consent, even during emergency situations. It contributed to stronger IRB oversight, increased requirements for community consultation, and there was a greater emphasis on transparency and ethical accountability going forward in clinical research.
In conclusion, this study highlights the challenges of balancing life-saving research with protecting patient rights. It shows the importance of ethics and transparency in all areas of healthcare research.